Hey there.
Hi,
How are you?
I'm good. How are you today?
I'm well, thank you so much. And we just jumped off. I kind of left you in the waiting room there
That's okay.
because Pam jumped in. But okay, so I'm just gonna fire away.
Okay.
We just and pronounce your name for me, so I might have butchered it the entire webinar.
Not really. It's Devana.
Divana.
So you
Okay,
were
you're
super close.
super close.
Yes.
Divana. It's like Madonna, but Divana.
Yeah, well, yes.
All right, Divana.
Yes.
Well, so Devana, just we just got out of our live Medicare 101 webinar,
Yes.
and I asked a couple of brave souls if they would hop on and do a quick little interview with me just to give some feedback. I have not coerced you in any way.
Nope.
No, even though
Volunteered.
I did sort of dangle out there like, hey, maybe I'll give a gift card. I don't care if you give me bad feedback or good feedback. But so I guess the first question I would say is, what's your initial like just thoughts on the webinar, and did you learn anything? Do you feel better about the situation, the Medicare situation, just anything? What you got?
Well, I definitely feel better about the situation. I am the one that has managed our health care for my family for the last, 40 years. And in fact, I went to work. My husband's self-employed, so I went to work to for the health insurance. And each year, I was the one that handled all the stuff and the choices for open enrollment. But this is different. With work, they give you these options, and you look through the options, and you've got a relatively small group of options to look at. But then when it goes to looking at the Medicare, it's whoa, it's so many more options. It's confusing. You don't know what you don't know. And when it comes to Medicare, you don't know anything unless you're in the business. So last year, my husband transitioned to Medicare, and I wish I had known then some of the things that I know now. Having been through that with him, I knew a little bit more of the questions to ask or the points to look for. But doing some research and looking at things and participating in your webinar has definitely made it, I feel a lot more confident. I'm still on the fence a bit, but I do feel like I'm better prepared and to make a choice and to look at the variables now than I did an hour and a half ago. It's very, it was interesting and engaging. And your third grade description is perfect for those of us that don't know what we don't know. So, it definitely is a good option. And, I'm certainly going to let friends know that this is a great way, to give yourself some more information and feel more secure. It is kind of concerning because, this is more of a permanent feeling than open enrollment each year on the job. And so even though each year there'll still be things to look at, it still feels a little bit more intense than the open enrollment before. So I really appreciate and my cousin Rita is the one that sent me the link and said, hey, check this out. Or, so she was on the webinar too. But anyway, so I appreciate being able to listen in and participate.
Well, we appreciate you joining, definitely. And I use that phrase all the time. I don't know what I don't know.
Yeah, I do too.
And you're right. There's so many things, and I could totally. That's the first time I've heard it that way. Like it's more of a permanent feel, even though you have
Right.
enrollment. And I
Right.
totally understand and relate. I think the biggest thing in that permanent piece that you're probably feeling is you don't want to mess up in the beginning.
Right.
And you don't want to miss the deadline. You don't want to get the penalties,
Right.
and you want to make the right choice. And I think I touched on that right at the end. It's like, hey, I'm on the fence.
Mm-hmm.
Well, if you're on the fence, I would suggest probably leaning towards the supplement just because, and I didn't dive into this because I wanted everybody to be able to get to lunch or whatever they were on their
Correct.
break. But I think Stanford did a study. I'm almost positive it was Stanford, that 64-year-olds, when the gap or the change between health diagnosis between 64-year-olds and 65-year-olds, it just skyrocketed. Like when you return 65, all these people were being diagnosed with various health conditions. And it's not because people were getting sick at that age.
They've just been ignoring stuff.
Ignoring it because they couldn't afford to go.
Right.
So when you get onto Medicare, you're like, okay, now I can afford it. I'm going to go get checked out. Well, full circle, I guess that's my point, is especially if you haven't been going or haven't, stayed on top of your healthcare, like maybe you wanted to, but it was expensive. Going with that supplement in the beginning, then you can go get checked out for everything under the sun. And there's no underwriting right when you're starting out on Medicare. So go get checked out. Hey, everything's good. Maybe we transition to Medicare Advantage the following year.
Right.
A lot harder the other way around.
Yeah. Well, and, we've been very fortunate and have had, I've worked for the state university system for, I'm retired, but I worked for the state university system for, over 27 years. Always had great insurance options. We've always, we're both, really healthy, have a couple of medications, but no big deal, just the normal stuff. And, but still, we've never had to think about the underwriting part. And, and that's another thing that sort of gives it almost like an eerie feel. We don't foresee, both of us are, fairly active and I'm actually doing a better job lately of, looking at my health than I have ever before. But still, the underwriting conversation coming up, we've never had to do that before. So it is something to think about. And y'all do make it a lot more comfortable.
Good. Well, I appreciate that, Devonna. And that underwriting piece can be scary. Mm-hmm. But just remembering that you don't have to go through underwriting if you start there in the beginning. And I'm not trying to sway you one way or another. Maybe that's a question you can touch on is, do you feel? I feel like so many people in our industry, I know that they push people towards Medicare Advantage because honestly, there is more money in that side for insurance companies, insurance agencies. You wouldn't think that because the supplement has a premium and Medicare Advantage plans, have zero cost, but really there's more commission on the Medicare Advantage side. And we pride ourselves on, educating, keeping it unbiased, let you choose. And, I feel like it kind of suggested that to you. So,
I feel like you evenly supported both sides as far as giving, a real life description of what could happen.
Good. Well, that's great. That's what, glad you enjoyed it. Glad that you jumped on. Hope you learned something. You said you learned a few things.
I did. I took notes, wrote them down.
There you go.
Stuff to think about. Like I said, I'm still kind of on the fence, but I do feel a lot more confident now than I did before.
Great. I'll say this too, back to your I don't know what I don't know thing. You can't make a wrong decision here. Both options are fine. They really are. Even if you are concerned, you're like, okay, supplement, and I feel very protected. But Advantage, oh no, maybe there's this unknown of some things, or there may be these costs. There are so many safety nets involved with the Medicare Advantage, with the max out of pocket. It's hard to hit that.
Right.
And especially if you couple it with a hospital indemnity plan or a cancer policy, it's kind of like a hybrid in between.
The indemnity plan is something that I was not aware of before. So that is really one of the things that I learned about. So, now that's something I know to ask more questions about now. Would have never known before this, webinar.
Good. Well, yeah, no, I think 100% if I was moving to Medicare right now and I was in between, it's like, okay, happy medium, that can fill a lot of those holes for a lot less. And yeah, it's a great option, and especially if you get that when you turn 65, because different carriers have different underwriting terms, like 6 months without underwriting, or some go all the way to 68 without underwriting on the hospital indemnity. But great. Well, thank you so much, Devonna, for
Thank you.
letting me pick your brain a little bit, and thanks for joining us. And I'm hoping we talk to you soon.
Thanks so much. I appreciate everything.
Thank you very much, Devonna. You have a great day.
You too. Take care. Bye-bye.
Thank you. Bye.